The Chatty Dentist provides general advice and insights on patient communication in dentistry. However, we want to make it clear that we are not affiliated with any dental council or professional organization. The information shared in this podcast is for educational and informational purposes only. We want to emphasize that the content presented on the Chatty Dentist should not be considered as professional, specific, or personalized advice for individual cases. We do not make any guarantees or warranties regarding the accuracy, completeness, or applicability of the strategies discussed. It's important to note that the dental regulations, standards of practice, and professional guidelines may vary significantly by region. Therefore, listeners are strongly encouraged to consult with qualified professionals or relevant authorities in their respective areas for specific guidance tailored to their unique circumstances. By listening to the Chatty Dentist, you acknowledge and agree that the podcast hosts, guests, and producers bear no responsibility or liability for any actions taken or decisions made based on the information provided in the podcast. We disclaim all liability for any direct, indirect, incidental, consequential, or punitive damages arising out of your use or reliance on the podcast content. If you want to get in touch with us, please email us at ask@thechattydentist.com. We want to acknowledge the Burunong people of the Kulin Nation as the traditional custodians of the land we are speaking from. We want to recognize their continuing connection to land, waters, and culture and pay our respects to their elders, past, present, and emerging.
Miss Smith, a 20-year-old new patient at your clinic today, complaining about appearance of her front tooth. She has recently finished her high school and started at the university, and she's studying law. She also works part-time at a law firm. She has gotten into a new relationship and the partner thinks that she has vampire fangs. She has anxiety and takes diazepam 10 mg 2 times a day. Address the patient's concerns, give the diagnosis and management.
The pointers here would be that we must assure patient about her smile, we must reinforce confidence, we should address the cause and management of her anxiety, and also discuss all the treatment options comprehensively. Let's dive into the role play now. Hi, Miss Smith. You did really well while I had a look at your teeth today. Are you doing okay?
I'm fine.
That's good. I'll just sit you up and let's have a discussion about what I've seen so far. So, what's the expectation that you have from your appointment today?
I want this tooth to look normal.
Okay, yeah. And is it the appearance that concerns you the most about this tooth?
Yes, it didn't bother me sometimes, but then personally, but then everybody who looks at me, then they think they keep like teasing me about it. So
I understand. But let me assure you, you do have a really nice smile.
from this side, yes.
It looks very nice. So I know that, because the tooth shape is slightly different from the rest of the teeth, you do feel a bit conscious about it. And, being in uni is not easy because, we are always judged and
Yeah.
we always feel like we're seen. So it's a bit intimidating that way. But you do have a really nice smile. So be assured that there is nothing that's that you should be very stressed about. Okay.
Okay.
I have noticed that on your medical history form you did say that you have a little bit of anxiety. Can I get a bit of more background on that? What triggers it, and what sort of management do you follow at the moment?
So it's more of dealing with people because I'm so conscious of probably how I look or the way I've been teased growing up. So it's getting better. I'm good with the medications I take. But yeah, now I'm a little concerned that maybe if I get this tooth right and I might feel a little more comfortable with people.
Yes, absolutely. And I do agree with you that, a lot of these things do stem up from other factors as well. So it's good that, you're on top of it. But does dental treatment scare you? Are you normally okay on the chair if you're
It's
being
my
treated?
first time, so you tell me.
You've done really well while we
Thank
were having a
you.
look. So I would say that you will do really well while, we do the treatment as well. And I assure you that I will do my best to make this a comfortable experience
Thank
for
you.
you. Apart from that, I've taken note that you don't have anything else on your medical history. Is that right?
Yes, I've been quite fine.
Okay, that's good. Any allergies?
Not that I know of.
Okay, great. And I will just briefly discuss with you what this is. This is called as a peg lateral. Peg is basically the shape of the tooth.
Okay.
A lateral is the tooth itself. So it's a
Okay,
lateral
okay.
incisor. So that's the reason why you have this unusual appearance of this tooth. There are various causes for this. Some say that if there was a trauma during the growing years to the tooth bud, that can lead to this sort of malformation.
Okay.
Some people say that it could be genetic, because if you have someone else in the family with a similar appearance, it can get passed down. Do you think you have anyone else in the family who probably has a tooth which looks like this?
No, I don't think so.
Okay. Unfortunately, they do say that females are also more susceptible to this.
Okay.
Again, no real cause for it. And in many cases, it's unknown, so it's idiopathic, as they call it. So we don't really know what causes this appearance.
Okay.
But the good thing is there's nothing serious about it. It's only a cosmetic thing rather than a functional or a medical issue there. It does not indicate that there is some other underlying problem there. It's just an appearance issue that you have there. However, like I said, we will definitely do our best to give you all the options to make sure that you have your expectations met with regard to the appearance of this tooth. Okay. Also wanted to know, have you had any dental treatment done in the past?
No, this is my first
Visit, so you've never had anything else done to that tooth?
Never.
And you had no symptoms as well on that tooth? No pain, no wobbliness, or no problems?
No,
with that?
nothing with the feeling, just the appearance.
Appearance, right? Yeah, I understand. So what we'll do today is I've had a look, initial look, so I'd like to do some further x-rays and I'll also just take some pre-treatment photographs as a baseline, and from there we'll work through to see how we can modify the appearance.
Isn't radiation harmful?
Not at this stage, because we now have modern equipment with lower exposure times, so it definitely is much safer to do these x-rays now in our practice with all the newer advancements that we have, so you're completely safe.
Good.
Okay. The x-rays will also help me to determine the strength of this tooth. So I can see what's underneath the cap of the tooth, and that way I can see whether it has good support from the surrounding bone, the roots, and that way I'll also be able to plan some future treatments which will be more appropriate for this tooth. The options that I can give you now is we could leave it as it is, but that's not an option for you because you really want to improve the appearance of that tooth, right?
Yes.
So the simplest one would be that we just build the tooth up with a tooth filling material, which looks like the color of the tooth itself.
Okay.
It's called composite. So we can use that to mask the appearance of the tooth. This can be done in the practice in a single visit. Does not need multiple appointments, and we help you pick the shade that you're happy with, and we can just go ahead and just build it up, and then you can have a look and see whether that matches the requirements that you want. The more definitive and slightly more complicated options would be that we put a veneer in there or we put a cap on top of it. So these options will require us to prepare the tooth a little bit. So we will have to grind the tooth a little bit just to accommodate the material which comes from the lab. That needs to be glued on really well onto the tooth. They are slightly more expensive as well, and they do need about 2 appointments as compared to the composite build-up that we were talking about.
Are these permanent?
I will not call anything permanent in dentistry, but one lasts a bit longer than the other. So which means that the composite build-up, which we're talking about, is a little bit less in duration when compared to the veneers and the crowns, which can last a bit longer. Only because of the materials that's being used in it. But they both come with a set of risks and complications. As with anything, they can be prone to chipping and breaking, if you're biting on something too hard, especially with composites, because they are nothing but a filling material, they are subject to staining as
Okay.
well. Yes. Veneers and crowns, they don't absorb stains as such, but they can chip and break
Oh,
as well.
okay.
Yeah. But for today, because if you're in the process of still making up your mind, we could start off with what is called as a mock-up, where I can let you pick the shade and then we just put it on
Will
the
it
tooth.
hurt?
No, not at all. It's just a preview sort of a thing for you.
Okay.
So we're not prepping the tooth. We're not doing anything. We're just going to let you pick the shade, and then we put it on the tooth. We just it's not permanent, and it's not like a definitive option. So it'll just last for maybe a day or two. But it's for you to analyze whether you like it or not. Check whether it meets your expectations, and also take feedback from people around you, and then you can come back and let us know whether this is something that you're
As long
happy
as it doesn't hurt, I'm happy to
Yes,
do that.
absolutely. Yes. And once that's done, you can always let us know whether you'd like to go forward with this, or if you wanted to choose another option, you're always welcome to do so.
So what you do today, that's how it's exactly going to come out.
The appearance wise, yes, that would give you a good idea about that's what, if that's what you want.
Can I get my boyfriend in? Can you please explain all this to him?
Yes, absolutely. Yes, I'm more than happy to do that.
Okay.
And we can let the decision be made by both of you, and then we could take it from there.
Okay.
And I'll also give some literature for you to take home. You can read through all the options that we've just discussed, and and then you can make a decision.
Okay.
Does that all sound clear to you?
Yeah, quite. Yeah.
Do you have any other questions for me?
Just scared about the pain, but other than that, yeah, nothing else.
That's all good. I assure you that we just, it's going to be a very simple, straightforward procedure.
Okay.
There wouldn't be any concern for pain at all.
Okay.
So yeah. Do I have the consent to go ahead and just do the mock-up for you today?
Sure.
Okay, great.